for the invitation to come and speak and to share some thoughts on the exposome from NIEHS. So I joined NIEHS way back in 2003, and when I came in, the early focus of my activities, trying to build a portfolio around really engineering, bioengineering, was looking at where's the gap, where are we missing out the most on information that can be useful for environmental health. And it really was enhancing the way we think about exposure and starting to build the capability to look at exposure the way it really happens as opposed to the way we've traditionally done it in environmental epidemiology, and embracing the complexity that is exposure and then the very wide array of axes upon which exposure varies. So whether we're looking at multiple exposures and different kinds of chemicals and physical and social interactions, where they're coming from, where we encounter them, when we encounter them, and so on and so forth. And starting then to think about the interface between that exposure and the biological system, and thinking about how the different exposures interact with different tissues and with different biological pathways to influence the health of the individual. So this led, we were thinking about this, and at the same time, Chris Wild, who was the director of IARC at the time, was developing the concept of the exposome and published his kind of landmark concept paper in 2005. And since then, I keep getting asked, how does NIEHS define the exposome? And my answer is, I don't really want to have a definition of the exposome because the exposome is not a thing. We can use the definition that Chris put forward in that 2005 paper, that is the totality of everything that you are exposed to from the time you are conceived and maybe even the time that your parents were conceived until the time you die. And you know, obviously that's massive, and there's no way we're ever truly going to be able to assess that. So let's think about, rather than a definition of the exposome, let's think about what are the critical elements. What are the pieces of a study that would be a study of the exposome that would differentiate it from what we've done before in environmental epidemiology or environmental health? So the first is, we're never going to be able to measure everything. The totality is not realistic. But we can measure a lot. So measure as many things as you can. The idea of multiple stressors and getting at mixtures is a key piece of the exposome. The second is trying to bring in multiple axes upon which the exposome varies. So thinking about multi-scale integration and looking at, you know, not just multiple chemicals, but thinking about the different ways we interact with those, whether it's temporal variability or spatial variability or biological context variability, and thinking about multi-scale integration. And then the third one, which is possibly the hardest piece of the exposome, and maybe the hardest piece to wrap your head around from a practical standpoint, is the idea of applying the exposome as a tool for discovery. So using the data without coming in with a preformed hypothesis to generate the next hypothesis and to discover the unexpected, and to use the data to inform the next questions that you're asking. So how does this look like in practice? So we could think about a hypothetical exposome project that comes in. And this investigator that's proposing this exposome project is really interested. It's a mixtures-focused project. So they come in, and the major point of emphasis for them is looking at multiple analytes. And they've got a little bit of piece of this looking at temporality of exposure and a little bit of looking at the biological interface. But they're really downplaying trying to understand where the exposures came from or when we were exposed to them. And then we can layer on other layers of variation on top of that, those kind of fundamental questions, and thinking about how are they approaching the exposure assessment. And they're using some primary focus targeted biomonitoring. They're using a lot of questionnaire. They're maybe doing a little bit of analysis of environmental samples, but they're not doing any modeling and they're not doing any remote sensing in this. Then they're putting it into a biological context. So they're doing some multi-omic integration, looking at biological pathways. They're looking at adducts of the chemicals, and they're integrating with biological response in the untargeted analysis to get some understanding of the metabolome. And then how are they thinking about using the exposome as they move forward? And they're really targeting, they're indexing the study as a tool for prevention. They're trying to identify ways that we can decrease the exposures that people are experiencing in an epidemiological setting. And we can contrast that with the second project that's coming in to look at the exposome that's really asking some very fundamental questions. Both of them are exposome projects, but this one is really more focused on when and where are we exposed, identifying the sources of exposure, and downplaying a little bit the multiple exposures. They're using some wearables maybe. So they're doing a lot of remote sensing, they're doing a lot of modeling, they're using personal monitors to get at that temporal spatial variation and the integration of geospatial data into the exposome. They're not doing any biomonitoring, they're not doing any questionnaire data. It's really a sensing kind of thing. From a biological standpoint, they're looking at interaction with the microbiome. Maybe it's the environmental microbiome as well as the personal microbiome and the metabolome there. And here they're really trying to get at some more fundamental epidemiology questions and maybe getting at some mechanistic insight through the microbiome metabolome interactions. And they're thinking about an ultimate application of this as a tool for risk assessment. So you can see that both of these are perfectly valid exposome projects. They're both very complex, very focused efforts, but they're completely different from each other. And this is part of what I think the community struggles with the exposome is, how is what I do the exposome when somebody's doing something completely different, and it's also the exposome? And what I'm trying to say is, that's fine, that's all good. And because if we can share that data and make that data available, it's useful to everybody. So early on, as we were starting to implement the exposome, we really did have a major emphasis on the gap there was personal exposure assessment. And how do we understand what an individual is exposed to in time and space? Major gap in the early 2000s. And we put a lot of money and a lot of effort into trying to develop technologies that would allow us to look at personal exposures. And once we developed some prototypes, we moved forward with trying to validate these. And the validation has been probably a 10-year focus for us of the wearable sensors. And there's some really key questions. And I think of it as like layers of an onion, although it's not a stinky onion. So the first question is just the validity of the data. Is it measuring what you think it's measuring at an appropriate concentration and sensitivity specificity to the questions that you're asking? The second layer is a question of usability. So are the sensors that we're using things that can be safely deployed, practically deployed in a way that is not providing any risk or burden on either the study investigators or the participants in the study? Can we get the data back off of the sensors in a way that we can analyze it? These are all questions that are very fundamental to the application of these new technologies. And if we're going to convince the epidemiologists to use them, we have to be able to give them this data in a very clear and convincing way. And then the third one, which is frankly the hardest of all of them, is the question of value. So what's the scientific value of adding this temporal and spatial resolution? We've invested millions of dollars in development of these technologies on a hypothesis that having this data will allow us to ask questions, to test hypotheses that we couldn't do without these technologies. And that's somewhat of an unproven hypothesis. We got some anecdotal data that says, yes, we can do this, and yes, it provides value. But to really convince the community to adopt these largely, we have to have that kind of killer app demonstration of the value of these tools over using a questionnaire to get at the same kinds of questions. So here's an example of one such sensor that we developed. This is a sensor for ultrafine particulate matter. This is commercialized by a company called Enmont out of Cincinnati, and a validation project that's being supported by Pat Ryan and Sang-Young Son at the University of Cincinnati. So this is a sensor for ultrafine. It's got very high sensitivity. It's a particle counting unit for particles between 5 nanometers up to a micron in diameter. It provides a count of the particles. It's about a liter volume of the actual sensor, and weighs about 2 pounds a kilogram for the sensor. And they're applying it in a study of asthmatic children in a school context. So you can look at the data in a couple different ways off of this. So the first is just looking at what is the exposure of the child. And so the way the protocol is designed, the child wakes up in the morning, they put the sensor on, and they go about their morning routine. They go outside to catch the school bus, and you see that there are some individual excursions in exposure, some reasonable particle counts there. They get to school. And they don't wear the sensor during the day in school. It sits in the nurse's office. And so you see there's very, very low levels of exposure in the closet of the nurse's office, which is not surprising. At the end of the school day, they go to the nurse's office, they get the sensor, they put it on, and they come out to the bus stop. And you see this very large peak of particulate matter due to the idling school buses at the school bus stop. And then as the bus rides home, you see each time the bus stops, when they open the door, there's a puff of ultrafines that come into the bus, and so you see these exposures. They get home, and they go about their routine, and you see some small blips that happen like with cooking, or perhaps maybe somebody smoking in the house. And so you can see very granular data of an average exposure you can calculate from this, but you see that there are going to be excursions that are well above that average. And so you think about questions that you could ask is it the intensity of those peaks, is it the frequency of those peaks, or is it just the average exposure that's exacerbating asthmatic symptoms? You can also look at this in terms of space and say, where are these exposures happening? And thinking about the individual spots at which you've got the peak of exposure. And so here's the image of the school, and you see that single high point excursion is specifically right where the school buses are idling, waiting to pick up the kids. So you can start to think about how you could use this potentially as a prevention tool. So Bob asked me to kind of tease some next steps in my presentation. So I think that we're going to continue this effort in developing and validating sensors for personal exposure, but we need to think about other ways that we can use this data. And specifically, we're talking with programs like the NIH All of Us research program, where they're going to have 1 million people. So that ultrafine particulate sensor costs probably in the neighborhood of $20,000 per unit. So if you're thinking about a 1 million person cohort, you're probably not going to buy 1 million units, but maybe you'll buy 100,000 units at $20,000 a piece. That starts to add up a little bit. And I don't think that all of us is interested in spending all that money. So let's think about where are there other sources of data that we can integrate. And so let's take these wearable sensors as step one of the data. But let's also think about can we use cell phones or other wearables to locate people relative to other people that may have a sensor. So we don't have to put a sensor on everybody, but we can say you're living in proximity to this person who's experiencing these exposures. So let's integrate your data together and say that your exposure is going to be very close to their exposure. And then let's think about other sources of exposure data that are out there. So there's the EPA Ambient Monitoring Network, and we'll see a presentation later from NASA, their global satellite imagery. So there's a lot of other layers of exposure data that are available that could be integrated to this. And we can put these people based on their location from their smartphone, what have you, into a mesh of exposures, and then we can also ground truth that with the personal exposure. So we can go both up and down in scales by doing this, and of course doing that will require a lot of computational effort, so let's maybe crowdsource the data so that we don't have to have a huge study staff that are doing this, making a game of analyzing the data, and building this into layers that allow us to think about the complexity of exposure. So that's next step number one. Next, number two is that's one study, and it's useful data and important data. But let's think about sharing that data and making that data available and available in a way that is harmonizable with other studies and have a public access repository for exposure data. And hint, we've got one available that we were actually talking this morning about the possibility of making that a repository for anybody who has exposure data, and I'll tell you more about that in a minute. But a system that allows us to share that data and interoperate that data through an ontology and mapping of data dictionaries onto the ontology so that we can ask common questions across multiple studies and harmonize studies. So that's next step number 2. So a little bit more on that, cheer and hear. So this is, Bob talked a little bit about it in the opening comments. This is an infrastructure program that NIEHS established back in 2015, initially focused on children, and its new iteration here is focused on the life course and all life stages. It's a network that provides access to capacity for exposure assessment. Analysis of biological samples and environmental samples through both targeted and untargeted analyses. So we've got a network of laboratories that are doing traditional biomonitoring, and you'll hear a lot about biomonitoring approaches in the meeting. We've got a network of laboratories that do untargeted analysis, and you'll hear a lot more about that from Doug, who's one of our grantees here. And then the environmental sample analysis, and I think you'll hear from Heather, who will tell you a little bit about that. So you'll hear from grantees of here in all of these analyses. But the idea is that we've got common materials that will be analyzed in every sample that we do. We've got a single ontology that links all of that data, and all of those studies are harmonizable and will be made available through a public access data repository, which, if things go the way we're hoping, that will be also a repository that those of you who are not here clients will be able to deposit your data and keep up with the forthcoming NIH policy on data sharing. So far, CHEER has supported 32 projects that will be archived in the public data repository. That's an analysis of somewhere on the neighborhood of 62,000 sample analyses that will be made available for a range of targeted exposures as well as untargeted, and some biological response anchors for those as well. And this is where the beauty of this starts to come in. So, as I said a couple times, these data are directly linkable. We've got common reference materials that are analyzed in all of these projects. And so you can directly compare, so for instance, if you're doing phthalate exposure, across, we've got about 7 or 8 different studies that are looking at phthalates out of the 32. That data is directly harmonizable for all of those. But you can start to look at, what is the role of phthalate exposures in a range of outcomes, whether it's asthma or neuro or obesity, diabetes, and you can start to ask a question of how does a single exposure or class of exposures influence multiple health outcomes. And you can also ask the inverse question. So we've got a number of projects that are looking at asthma or neuro, and a number of different panels that are being analyzed in each of those projects. So you can start to think about how do multiple exposures influence the same outcome. Or, if you're truly enterprising, you can throw all of that data into a blender and say, how do multiple exposures influence multiple outcomes in a really complicated way that looks across 62,000 sample analyses to really try to anchor this. And as we fill this out with here, you'll be able to ask more deep questions on windows of susceptibility and timing of exposures that will add extra layers of complexity on top of this. So the third, and I think final next step that I'm going to outline today is the untargeted analysis and the critical gap there of how do we identify and annotate the unknown features that we identify. And most importantly, in a service-oriented program like here, how do we report the confidence with which we're making that identification or annotation that is in a way that they can understand. So we're working on this. This is a work in project or a work in process for here, thinking about how do we state the confidence of an identification for an untargeted feature. And it begins with the question of, do you have that analyte in your standard reference library? So do you have an authenticated standard? We know that this is monoethyl huscyl phthalate. We've got that standard, and if we see that feature, we know that that's that. Then the question is, how tightly are you matching that association to the standard. So is it matching on retention in the chromatography? Do you have the parent mass, and as you fragment it, do you see the same fragmentation pattern? So that's what is the current Szymanski level 1 annotation for those who are metabolomics people, and we have a direct parallel to that. Then the second question, if you aren't matching quite as specifically, so you've got mass match on the retention, you have match on the parent mass, but you didn't look at the fragmentation pattern for that one. So you've got a slightly less confidence of that. So that's a level 2A. Or maybe you have the parent and the fragment mass, but the retention is shifted a little bit. And so there's a reason to suspect that that's not exactly a perfect identification. The structure is probably correct, but the parent compound might be shifted a little bit. So a grade 2B. And then as we move down, you have less and less confidence in the annotation or the identification. And maybe at the bottom level in S5, you can report, this is probably the chemical formula of that feature, but we're not going to make any guesses about what the structure are. Alternatively, you might not actually have that compound in your standard, authenticated standard library. And so instead you're going back to the databases and you're trying to make a predictive match. So you're going to HMDB, PubChem database, the Metlin, or NIST. These are massive PubChem 65 million compounds, massive databases of chemical information. And so we can go through exactly the same series of data to match those confidence intervals with the predicted. But because you're not matching it to an authenticated standard on your specific platform, there's maybe a little bit of an asterisk with the confidence with which you're reporting that. It is okay to make an identification if you've got a very high confidence identification from the database match, but it's not quite as much confidence as if you were testing an authenticated standard on your same platform. And then there's the third category, which are the Donald Rumsfeldian unknown unknowns. These are features. That's all I'm going to say about them. You know, there's something there, and we don't know anything about what that could potentially be. So we're not alone in thinking about this. The metabolomics community is also struggling with the idea of how do we report the identification and annotation of unknowns. And they've actually developed a framework which is out for public comment right now. It closes in about a week and a half. So if you're interested in providing your feedback on this, the webpage is here, or I can provide that to you if you haven't seen it already. Their framework is quite a bit different. It takes those earlier frameworks, but it adds a lot of granularity. So their highest level annotation of the level A and level B is really not feasible with the vast majority of today's metabolomics approaches, where they're wanting to have you report the stereochemistry and the chirality around the chemical bonds. And that's something that a mass spec just really simply cannot capture with today's technology. There's some approaches that you can do to get at that with chiral chromatography, or NMR can address a lot of those things, but there's some trade-offs if you're using those approaches, mostly in throughput and sensitivity. So the proposed here level 1, S1, or the Szymanski level 1 is really a grade C here, where you're reporting a chemical structure without that stereochemistry. And then it goes down from there to essentially reporting a chemical structure or formula for those. So as I come to an end, you know, some key take-homes from you. So exposure, we all know this, but a lot of times we pretend we don't, is a very complex phenomenon. And I think that the essence of the exposome is to to embrace that complexity and not try to control it away. Untargeted analytical methods are really kind of a key approach for the exposome, and they allow us to do data-driven discovery. Here is a resource that is available to provide access to these kinds of capabilities, and the compound identification and annotation and reporting of the confidence of identification is a major bottleneck as we move forward. With that, I will come to an end. I'll say thank you, and if we have time, take one or two questions.